Well, thanks so much for joining. Speaking of making healthcare work for you, I'm Stephanie Fields, and today I'm joined by my co-host, Dr. Apoorv Gupta, and Aman Magoon, who is the head of product at Nayya. Thank you both so much for being here.
Thank you.
So, Aman, I'm excited to talk to you. I actually interviewed the founders of Nayya, Sina and Akash, and I love what Nayya is doing. Can you tell us a little bit, because you've had some exciting developments very recently?
Nayya is a insurtech company that lives at the intersection of an employee's finances and their health. And we seek to make an impact in their lives by helping them choose and use their benefits in a way that leaves them with savings and the coverage that they need. Earlier this year, we had the pleasure of announcing our Series A round of funding, which allowed us to grow our team, bring on a bunch of really great practitioners who have deep employee benefits experience, as well as deep data science experience as well. And so that's really indicative of kind of the type of company we are. We're a benefits company that is powered by data science.
It's so great. And that's one of the things that struck me before, is that Nayya is really able to provide hyper-personalized suggestions for people, helping them get into the best benefit plan for them. How big of a problem is it with people choosing the wrong benefits plans?
Yeah, I mean, that's a great question. So in 2019, I believe 66.5% of personal bankruptcies were attributed to healthcare costs. And so when you peel the layer of that onion back a little bit, and you start to understand why it is that healthcare is oftentimes the cause of personal bankruptcy, it's really two things. Number one is the cost of care, so how much you have to pay the provider if something is to happen, and so that's one side of the spectrum. The other side of the spectrum is actually people going into debt due to the fact that they can no longer work, or because of time out of work. And so when we double click into the time out of work component, we realized that we as a company can really help solve that problem by directing people to the right benefits during open enrollment and throughout the year. So if you're in the right plans, you can afford to take time off of work and manage your health and not have to make trade-offs between putting food on the table or seeing your provider.
I guess I never made the connection, because I always thought it was those people that didn't have insurance that were going bankrupt. And I think you're implying that it's partly the people that do have insurance, depending on the benefits they have. I'd love to understand better who are the people that have insurance that could be at risk for personal bankruptcy, and how do you help those people?
What's really telling is that in the years of the rollout of the Affordable Care Act, Obamacare, a lot of economists and the pundits thought that, because the Affordable Care Act is now going to grant coverage to a lot more Americans, we're going to see this dramatic drop in the number of personal bankruptcies associated with healthcare. There's tons of measures to show the genius of the Affordable Care Act. One of the startling stats is that personal bankruptcies didn't flatten out, they didn't decrease, they actually steadily increased in the years after the rollout of the Affordable Care Act. And the reason for that is exactly what we've been talking about, which is the high deductible health plan, right? It's a consumer-driven health plan that provides you with coverage for a rainy day. It provides you with coverage beyond this high deductible, this high out-of-pocket spending. And so that core of the population that is enrolling in these high deductible health plans, while they have the benefit of the HSA, while they have the cost savings at the onset associated with the lower premium, they do actually need to enroll in some sort of income protection or some sort of $0 deductible gap plan that gives them that protection from the $0 to the deductible. And so that's kind of the segment of that 66.5% of people that Nayya is looking to help empower with greater and better decision support.
Despite that risk of the high deductible health plan, you still think that there's a benefit for those people that are able to figure out how to sign up for it and get all the other voluntary benefits, set it up properly. Is that the message I'm getting?
Yes, absolutely. So The high deductible health plan is great when you know how to use it, and when you are contributing to an HSA, when you understand how that works, and when you're enrolling in some sort of voluntary benefit to provide you with that sort of rainy day coverage.
How do you work with those people and make sure that they are in the right plans, especially if it's somebody who might be traditionally used to being in a PPO and you're suggesting that they're in an HDHP because it's going to save them money?
The percentage of an employee's income that goes towards their benefits can range from anywhere from 2 to 7%, depending on, your average salary, right? And so we think that it doesn't make sense that employees are spending so much money towards their benefits, but there's no personal experience around choosing those benefits. If you go to Amazon.com today and you go to the landing page, you're going to be immediately inundated with tons of recommendations of products that Amazon knows you should be buying because of the relationship that they have with you. E-commerce companies, social media companies have used personalization to promote this reaction from its users. Our goal as a company is to use personalization not to get you to transact or not get you to scroll, but really to improve the employee's benefits literacy and then ultimately influence the decision that they make during enrollment and choosing their benefits. Our strategy, and I think what makes us unique as a company, is the fact that we're using third-party data integrations. We're using both public and private data sets to power everything that we do. So things like understanding how much you've spent year to date out of pocket towards your medical expenses. When you're enrolling in benefits during open enrollment, Nayya is able to bring to the table because of our diverse API strategy with major medical carriers. Things like understanding your personal debt and mortgage amounts when enrolling in voluntary life insurance or disability insurance. Nayya is able to surface that personal information to the employee during enrollment, so we can influence those decisions and help the employee find additional coverage where they need it. And so it's really a combination of creating a personal experience, empowering that personal experience with the world's data.
I think it's so interesting that you're using things like the debt load that people are facing, because that's something that no other company that I'm aware of, they could exist, but I don't know of any that are pulling in that type of data for benefits decisions. Because pulling in claims data, it's really important, but nobody ever thinks about the actual non-work related spending that people are doing. And those are the types of things that really can influence your decisions and should influence your decisions, because it's a tremendous risk to not have the right plan when you have other debt or other issues in your life.
It's certainly not an easy thing to do. And I think part of the reason why no one has done it is because it's a complicated problem to solve. The identity resolution work that goes into understanding John Smith in Baltimore, Maryland versus John Smith in Manhattan, New York is a complicated problem. And so we, like I mentioned at the top of the discussion, we are a team of data scientists that have dedicated our efforts and our interests in doing what advertising technology has done, or doing what e-commerce has done with the third-party cookie, and how the third-party cookie is essentially the source of truth for all things about a user on the internet. And because in the benefits ecosystem, we can't leverage the third-party cookie, or there isn't a corollary to the third-party cookie, Nayya has taken it upon itself to normalize and identity resolve all these different attributes about the employee. Another investment we've made from our technology is this notion of bundling of decisions, right? If I'm a consumer and I'm buying an outfit because I'm going out to dinner, it's much easier for me to buy an outfit at a time than having to buy shoes and socks and jeans and a button down and a blazer. In a similar fashion, what Nayya has done is we've taken this sometimes 10 to 15 long set of decisions you have to make across these different benefits, and we've said, hey, this is the recommended bundle that Nayya is saying that you should enroll in, and this is why. And the why we think is really important. So instead of getting into the minutia and the fine print of each and every single benefit, we've spearheaded this idea of scenarios. And so based on how you respond to our questions around lifestyle and finances, we'll position scenarios back to the employee that they'll resonate with to highlight the relative benefits of the bundled plan versus a non-bundled plan. So an example, for instance, would be if you're an employee who's providing coverage for your spouse and your children, and you've responded to Nayya saying that your children are quite active, for instance, we'll provide a scenario to say, hey, if your child gets into a sports-related injury and needs an ambulance and needs 2 days in the ER and then needs specialist treatment after that, this is what life looks like on your kind of core non-recommended bundle with just the major medical, and this is what life looks like from an out-of-pocket spending perspective if you had bought the accident insurance plan. And so we're using these scenarios to tell a story to the user in a way that's responsive, in a way that takes into account the way that they've responded.
All of these amazing data points that you have allowed you to come up with some really great findings that you shared in the press release for your most recent round of funding, including one point that is particularly interesting, that on the Nayya platform, 40% of people enrolled in voluntary benefits versus 14% off of the platform. How do you attribute such great adoption of those plans?
There's a number of reasons. We've seen kind of increased participation in these benefits. Going back to the personalization, I know I'm going to sound like a broken record, but the reason employees in previous years weren't adopting these plans is because A, they didn't understand how they worked, and B, they didn't know that they needed them, right? I hear it all the time where I'll get on the phone with the user and they'll talk me through kind of their benefits journey from the previous year. And I'll say, hey, why didn't you enroll in accident insurance last year? Why didn't you enroll in critical illness insurance last year? And I'll hear things like, oh, well, I'm young and I don't need accident insurance. Or, I'm healthy and I don't need critical illness insurance. And while to the user, those things make good sense, from a benefits perspective, just because you're young and you're healthy doesn't mean you don't need accident insurance. Doesn't mean that you don't have the same income risk that an older and less healthy person has should something unexpected happen. And so we've used personalization, we've used responsive design. And the one thing that we haven't used is insurance jargon. You're not going to find much insurance jargon on any of our interfaces. And so simplifying and humanizing this very human decision, I think, is what we attribute that participation increase to. Nayya, of course, is not a company that benefits financially from boosting participation. That's not why we're in the business of doing what we're doing. Our North Star is always the consumer. So we're trying to do right by the consumer no matter what we do. And it turns out that doing right by the consumer ultimately means helping them understand the role of the voluntary benefit in this world where consumer-directed health plans or high deductible health plans are more and more popular because of its affordability.
You found through your data that millennials are actually becoming more risk averse after dealing with COVID.
We were lucky enough to kind of see this early feedback loop just in the work that we did during Q4 open enrollment last year, where, in previous years, employees were spending around 18 minutes on average, both learning about their benefits and then enrolling in their benefits. So it's 18 minutes in the entire year that they're spending to actually learn about benefits. And if you think about that, you spend more than 18 minutes buying a pair of shoes online. And, for the amount of money that you're spending on your benefits and for the amount of impact that it has on your life, spending 18 minutes on average just didn't make any sense to us. What we've seen from our average user is that they're spending about 24 minutes learning about their benefits, understanding their benefits, experiencing the personalized decision support that Nayya has powered for them. And ultimately, we're seeing millennials are taking a greater interest in their benefits and are enrolling in an increasing number of products.
And I find this fascinating. One thing this reminds me of is when we were speaking earlier, you had mentioned that in the benefit space, more is not always better, especially in healthcare. And I wonder how that works, because your benefits decisions based on data and what I've consumed in the past year, but is there a chance that misses something and that in the next year, I don't know, but I'm going to get hit with, unfortunately, some tragic illness, and now I don't have coverage for that?
It's a great question, and we think about it a lot. There's always risk involved in making these decisions, and simply buying more benefits isn't always the best, because you have to consider the opportunity cost, right? Buying the Cadillac plan, the PPO plan for you and your family during enrollment may seem like a great idea, and it may even be affordable to you. But when you think about the opportunity cost of that decision, you're now overpaying on premium per month by anywhere from 40 to 50%, right? So you're paying more on premium. And then you're also missing out on this great investment vehicle that is the HSA. And the HSA, of course, has the pre-tax advantages of depending on your tax bracket, 30% savings right off the bat. But it also has this component of growing over time and compound interest that grows based on how risk averse or how conservative you are. And so the opportunity cost associated with buying more benefits is the HSA and the premium savings.
You had said that a lot of people don't actually understand how the HSA works.
The 401k has been the hottest kid on the block for far too long. Everyone can recite in their sleep how a 401k works. It's marinated itself in the fabric of the working America. And so, but what they don't understand about the HSA is it essentially acts in the same exact way. It's a pre-tax contribution. Your employer oftentimes will contribute toward your HSA as a benefit. It's investable and it's portable. It goes with you where you go. So there's this educational gap and this learning curve that working Americans haven't necessarily adapted to. And so we've used our technology to help catalyze that learning and help promote that learning. The HSA is not always the best source of, it's not always the best way to pay for care throughout the year. Oftentimes folks who have an HSA are looking to their HSA anytime they have a patient responsibility and they have to cover some out-of-pocket expenses. What Nayya says is, hey, if you have enough savings and you have enough of a rainy day fund to pay for your medical costs, your routine medical costs throughout the year, don't touch that HSA. Let that HSA grow and build over time, because when you do retire, you can use that account for any expenses associated with living.
Where do you see all of this going? You say millennials are getting more risk averse. Stephanie and I have been doing a number of shows in healthcare, and specifically we're finding out about the complicated needs that are emerging, telehealth, behavioral health. Are you seeing differences emerging in the next few years in terms of what people will need in their benefits programs?
We really want to be at the cusp of the innovation of the benefit space. And we think that over the next few years, you're going to start to see this idea of robo-insurance or robo-enrollment, where because of technology platforms like Nayya's, employees are at a greater advantage when they allow the technology to make the decisions for them and simply provide consent and approval for what the technology deems to be the right bundle of benefits. And so that's where we see the benefits space going. Is where we see insurance going, where these things are being allocated for them based on their own experience and based on their own needs.
What personally excites you about the work that you're doing and the changes that you're making?
Personally, I'm excited by relationships. I think that the thing that inspires me the most are the people both that I work with and the people that I serve and the people that I have an impact with. And getting on a phone call with one of our users, or getting on the phone with employers that we work with, and just listening to the experience of our end users, I think is tremendously inspiring to me, and what keeps me really motivated to continuing to solve the problems that we're solving. I'm also quite interested in the technological challenges that solving this problem is going to beg. I think the combination of the relationships and just the complexity and challenges of the nature of the problems we're trying to solve is just tremendously inspiring.
Well, thank you so much. Thank you for being here. I really appreciated this conversation and learning all about everything you're doing. And thank you all for watching. Bye-bye.
Thank you so much.
Fascinating. Thank you, Aman.